Thank you, Mr. Speaker. I rise today to speak in strong support of my bill, H.R. 4531, the Support for Patients and Communities Reauthorization Act. Over the past 2 years, we have lost over 200,000 Americans to drug overdoses and poisonings. This is a step in the wrong direction, as the United States saw decreases in year-over-year drug overdoses between 2018 and 2019. Tragically, our best efforts to drive down these overdose rates were disrupted by the COVID-19 pandemic, which left millions of Americans isolated and shuttered from support systems that helped those struggling with substance use disorder stay on track. These statistics show the policies and programs we enacted in 2018 were working prior to the pandemic. But since 2018, we've seen the horrors that illicit fentanyl and other illicit substances like xylazine have caused our local communities. In the past 3 years, over 70% of all drug overdoses in my home Commonwealth of Kentucky has been the direct result of poisoning from fentanyl or fentanyl-related substances. Earlier this year, I convened the Energy and Commerce Health Subcommittee field hearing in Gettysburg, Pennsylvania, where we heard firsthand accounts from law enforcement and treatment providers about the harsh realities of this crisis. We heard heart-wrenching testimony from Michael Straley, who lost his daughter Leah a few years ago to fentanyl poisoning, underscoring the daily stresses of families who with loved ones battling substance use disorder. That work has helped inform the bill before us today. We are reauthorizing important programs such as state-level prescription drug monitoring programs, residential treatment for pregnant and postpartum women, and other prevention, treatment, and recovery services. We're also placing xylazine into Schedule 3 of the Controlled Substances Act while maintaining access for veterinarians and ranchers to use in animals. Xylazine is an emergency lethal street drug that has a unique threat as it is not an opioid, so it does not respond to FDA-approved opioid reversal medications. That said, H.R. 4531 provides even greater access for treatment providers to use federal funds to purchase over-the-counter opioid overdose reversal medications, which we know have helped reduce the opioid overdose rates in communities across the country. We're also building on important steps we took in 2018 to help those that rely on the Medicaid program access care. We are permanently requiring Medicaid programs to provide life-saving medication-assisted treatment. We're permanently codifying the flexibility for states to waive outdated policies that prevent vulnerable individuals from seeking comprehensive wraparound and substance use disorder care. We're also assisting foster care youth by ensuring they do not lose their Medicaid services if they are receiving the behavioral care they need at qualified residential treatment programs. Finally, the legislation before us today promotes access to long-term recovery and support services, like workforce training for individuals in recovery. In closing, I want to thank my Democrat co-lead, Representative Cathy Custer, Ann Custer, for her help on this important legislation and her historical leadership on addressing the opioid crisis. I also want to thank my colleagues for working with us to ensure the policies of H.R. 4531 are fully offset, which is essential to ensuring this legislation can get to this point. Again, I want to thank my colleague from New Hampshire. I mentioned my colleague from Florida, but my colleague from New Hampshire for working with me on this bill. And I urge my colleagues to vote yes on H.R. 4531, and I reserve my time.